This is Hemang Panchal. Today we have a case of bifurcation STEMI with modified mini crush technique using 6 French guide, a step-by-step approach. Disclosures? None. We have a 53-year-old man with history of CAD status post PCI to the RCA. He has been having sweating walking upstairs for last couple of weeks. He was in the gym lifting weights and started feeling sick and started having chest pain. EMS was called and en route to the hospital he went into cardiac arrest with VFib and he got one shock which brought him back to sinus rhythm. His risk factors were CAD and hyperlipidemia. His EKG shows acute anterior elevation microinfarction. His diagnostic angiogram was performed using a right radial approach and 6 French slender sheath, a 5 French catheter showing a thrombus and subtotal occlusion in mid LAD extending into the second diagonal branch with STEMI2 flow downstream. The RCA had mild disease in the mid to distal segment. I used XB30 guide. I wired both branches, the diagonal branch and the LAD using the workhorse wire. Then I passed a 2.25 by 10 mm compliant balloon for balloon angioplasty in the mid LAD. Then I performed a balloon angioplasty of the diagonal branch using the same balloon. This is the angiogram after balloon angioplasty of both LAD and diagonal branch. I performed this procedure using a 6 French system. Now with the 6 French system, it may be hard to pass 2 stents at the same time. Therefore, I had to use modified mini crush technique. First, I passed a balloon which is 2.25 by 10 mm balloon in the LAD, and I passed a 2.25 by 10 mm regulating stent into diagonal branch. I position the stent in the diagonal branch. Before I deployed the stent in the diagonal branch, I made sure that my LAD balloon is past the stent in the diagonal branch. So then I deployed the stent in the diagonal branch. Once I deployed the stent, I pull back the diagonal branch balloon and flare out the ostium of the diagonal branch stent. The advantage of that is recrossing will be easier. Then I pulled back my LAD balloon and perform a kissing balloon with the stent balloon in the diagonal branch and then 2.25 mm by 10 mm balloon in the LAD branch. Then I position the drug-eluting stent in the LAD, which is 2.5 by 12 mm drug-eluting stent. I deployed the LAD stent. Then I pull back the wire from the diagonal branch out of the diagonal stent as well as the LAD stent. Then I recrossed the wire across the stent strut into the diagonal branch. I used the same wire. Then I passed a 2.25 by 12 millimeter balloon into the diagonal branch to flare out the O-stem of the diagonal branch stand and the strut of the LED stand. And then I performed kissing balloon angioplasty using 2.25 by 12 millimeter balloon in the diagonal branch and 2.5 by 10 millimeter balloon in the LED branch. And this is the final angiogram, which shows excellent results. Thank you. Please feel free to leave any comment if you have any question or concern, and please subscribe to my channel. I'll keep uploading new videos.